Welcome to Beyond the Breakwater, where just beyond the crashing waves of fear, discomfort, and doubt lies the greatest potential for life transformation. We want to guide you into the open waters where the calculated risk you take becomes the turning point for you or your organization to thrive. So draw up your anchors and prepare for departure in this week's episode of Beyond the Breakwater. Welcome back to this week's episode of Beyond the Breakwater. I'm Lyndsay, and with me I have Ed, and then we are joined again for another week with Jen. She is the practice manager of Gateway Healthcare. So welcome back, Jen. So last week, if you didn't listen, I would tune into that episode. We've done a few episodes on Gateway and just covering what it is and just hearing Jen's story. Last week, we talked about like the brokenness of the healthcare system, insurance, and kind of the nightmare that is. And it was really interesting, actually, because right before recording this episode, we were talking with somebody who is an EMT, and she was sharing that the crisis that people face when they are in the ambulance is like, she hears all the time, like, what happens if I can't pay for this? Like, what happens if insurance doesn't cover it? And just like that fear. And we were all just kind of resonating with like hearing it last week on the hospital side of things. But from her position, like, she is dealing with exactly the people that are in crisis on their way to the hospital. So I think that just captures kind of the fear and the exact brokenness of this system, that as somebody needs healthcare, their first line of thought is, how am I going to pay for this? And do I want to pursue further once I'm at the hospital? Or like just this fear of like, what else is going to unravel when I'm there? And this is something that everybody needs. Like, all of us have a right to healthcare and healing and feeling like our bodies are operating as they were meant to. And so like to put a dollar on that, or to have insurance companies be the first thought of your mind when you're feeling sick and you just want to be better, I think that kind of just speaks to our conversation last week.
You know, I had a issue with that just the other day. So it just kind of reminds me of what happened just 2 days ago. I was at a chiropractor because I had hurt my back. I lifted a transmission, hurt my back. I was at a chiropractor, and he was, part of the treatment was using laser. And I asked, I said, you know, I'm not sure how much the laser costs whenever we do this, but we have a deductible. This is out of my pocket. How much is this going to cost me? So instead of getting the treatment, my first question was, can you tell me how much it's going to cost before I say I want this? Or do I just want to get an adjustment? So I was in the same place just 2 days ago. And it's just like, whoa, how much is this? And he said, oh, well, I'm just doing this. I'll just include this. That's fine. I'm like, okay. And he goes, well, we'll bill the insurance and see what they do. And I said, well, that's what I'm concerned about.
Yeah, it's like, this is not just a test. We'll see what happens.
Yeah,
like, this is
like,
money out of my pocket.
That's right. And if they choose not to do it, then I'm going to have to pay for it.
Right.
So this is what we're talking about, why we're all concerned when we get sick. We're all concerned about the dollar amount.
Yeah.
And so, Jen, maybe let's start there. Let's talk about the dollar side of healthcare. How much does money drive the whole industry of healthcare?
Oh, money drives all of healthcare. You know, we talked last week about the profitability on the provider side. Well, and insurances not wanting to pay for services and so on and so forth. But, you know, insurances really want to dictate a lot of times what providers do and what they don't do. And as a matter of fact, one of our providers, Sean, prior to coming on board with Gateway, she was getting really frustrated because insurance companies literally tell the providers, this is what you can do, and this is what I don't want you to do. And speaking a little bit further in depth on that, my husband is on a large amount of medication, and my insurance company sent me a letter in the mail a couple of weeks ago and says, we noticed he is on all this medicine. Call us and we will go over your medicines with you to determine if you actually need these.
So the insurance company is going to determine what you need, not your doctor or not your providers.
Or the pharmacist. Yes, exactly.
And who knows who you're actually getting on the other side of that line in the insurance industry. And I just want to be a little bit cautious. I don't want to demonize the insurance because I think we're grateful, especially when it's catastrophic and the insurance is there, that of course we couldn't pay those bills, especially when you wind up in the hospital. So, I mean, I think there's some good, but we're also seeing that there's a lot of challenges with that too, especially when they don't want to pay, and especially when they don't want to pay a provider or the clinic. And then you have to fight to get what they said they would do for you. And I think that's what sometimes can be the problem. Is that a fair statement?
That is a very fair statement. And insurances do a lot of good. And they, obviously they offset a large amount of costs for the vast majority of patients that have it. However, I do think there needs to be more regulations where it's concerned as far as what they can and what they cannot do.
Okay, so let's talk a little bit more about the frustration that doctors have, because we interviewed a lot of doctors to be our overseer of our clinic, and so many of them didn't want any part of it because they wanted out so bad. And they were talking about the brokenness of the system, that they couldn't do treatment as they wanted to. Yes. They had to do what was being mandated. Can you talk us through that? What were they referring to?
Again, that's where, the insurance companies mandate something. So, again, going back to the insurances telling a provider what they can and what they cannot do. So I have a patient, hypothetically, comes in with a cough. I'm concerned that this patient may have lung cancer. Maybe they lived in a house with asbestos back in the 70s. The insurance company says, no, I'm not paying for a CAT scan. That's not what you need to do. You need to do a chest x-ray first and send them to a pulmonologist. If I'm thinking lung cancer, we might not have that kind of time. We need a CAT scan, please. So they are dictating the levels of treatment. And I'll give you a for example. I know of a family member by marriage, I will word it like that. It's not to put all of her personal business out there, who had a specific form of cancer. And she had to jump through all of the hoodle hoops like that. And the cancer was quite aggressive. By the time she was able to get adequate testing to figure out what it was, because the insurance companies dictated to the providers what could and could not be done first.
So in the instance that now, like Sean, our provider at Gateway, she's there, what makes Gateway different where she's able to kind of advocate for her patients or order certain tests that need to be done?
Because, again, a lot of our patients are qualified, so we can kind of go through the back door, if you will, with the assistants to get them the help that they need. And we're going to advocate. Like with that patient in the segment with Jim, she called 14 different places to find the one to help that patient who would take her. And that's what we're going to do. We're going to call around. We're going to find the place that will take you. As they say, it's not my first rodeo. When I was at my very first practice many years ago, I did that for patients back then too. I was calling places out of county up into Roscommon to find places that would assist certain patients as needed.
So, I mean, sorry, when you say like they're patients that are qualified so you can kind of slip through the back door, is that just because like they don't often have insurance that you're capped?
Or they might be underinsured.
Okay. So if they do have insurance though, or they're underinsured, meaning like they still have insurance, it's just they might have really high deductibles, aren't you still playing the game of having to comply with whatever insurance companies are telling you?
You will, but you have that patient assistance option to where they still have that cushion, if you will, to where they're not going to have to pay astronomical amounts out of pocket when the insurance denies payment. So it's not that the insurance can't be billed. Insurance, you can bill them for whatever you want to bill them for. It's the insurance will come back and say, I'm not paying for that.
Okay. So that's where kind of like the politics or like playing that game gets involved, is the insurance company will dictate to the provider what you can and can't do. Like in the instance where someone has a cough and you want to order a CAT scan, insurance company says no, you can still order a CAT scan, but that patient is just going to have to pay out of pocket, which would be an astronomical price. Or now in this case, because they qualify at Gateway, they would qualify for assistance at the hospital, you can still order that CAT scan, but it's covered.
That's correct.
Okay.
Yep. You can, like I said, you can still bill the insurance. The insurance is going to deny payment.
So what's the challenge for the person that walks into the hospital who's uninsured and a whole list of things start to get, we want to test all these different things?
Well, I mean, if they're not aware of the assistance, they're not aware of what is out there resource-wise, then, and therefore they don't apply for those programs, they're going to get hit with very large bills. And like myself, once upon a time, at a certain point in time, they're going to get sent to collections, their wages are going to get garnished, and their very difficult financial situation has just went from bad to worse.
So ironically, the other day I was sitting in a meeting and just sitting next to a gentleman next to him, and I'm like, so what do you do? He goes, I'm a bill collector. And I said, oh, really? For who? And he goes, for healthcare. And I said, for real? He goes, yeah, that's what I do. And I said, well, how is that? He said, well, it's really hard because he said there's nothing that a bill collector can do if it's less than $500. It doesn't go on your credit report. We just call and call and call and call and call and hoping to get something for them to pay their medical bills. If it's over 500, I guess that they can attach it to your credit report. So I would imagine a lot of people's credits being wrecked because of something that was maybe out of their control. They got sick. Now they have all these bills. I was reading not too long ago that about 1 out of 4 people have $10,000 in medical debt in America. 1 out of 4, that's 25% of people have a medical debt. Okay, so let's go back to Gateway. What's different about Gateway? Will they ever have that?
No. I mean, if we will give you, if somebody has a bill with us that they haven't paid, which we're going to bill you that $40 after we bill your insurance and you're qualified with us, we're going to bill you. We are going to give you ample opportunity to communicate with us. If you pick up that phone and you say, Jen, I don't have $40 right now, but I have $5, and next month I can give you $1, I'm okay with that. I'm going to work with you. If you communicate and make some kind of an effort, I don't care if that effort is a quarter. Just communicate with me, make an attempt. That is all I ask. And I ask only that because I have been there. And I'm not going to take your dignity from you because I've had mine taken from me.
Jen, can you maybe go there? Because I feel like you've been referencing a lot between last week's episode and this week's episode. Like your empathy is for the patient and the situation that they're in. Like you've talked about, like, I've been there from personal experience, drawing on this professionally or personally. Like, what is that personal story to you?
So I mentioned last week, being Alice, being in poverty my whole life, bad decisions and so on, and barely scraping by. And I also mentioned losing my health insurance, my Medicaid, because I made a whopping $8 an hour, which, FYI, in case you wondered, $8 an hour does not really pay the rent and put food on the table. I am just saying. So from 2003, when I got that very first job as a medical assistant, to almost 2016, when I earned my very first college degree and got my promotion at my previous position, I was without health insurance. My husband and I were. My husband had untreated hypertension, high blood pressure, and we knew he had untreated high blood pressure. High blood pressure meds are super inexpensive. The office visits and lab tests were not. Going back to that thousands of dollars, we couldn't afford that, so we turned up the proverbial car radio so we didn't have to listen to the noise, right? And 2017, he was diagnosed with chronic kidney disease, stage 3. And December 20th, 2021, we got the phone call that he would need dialysis. Sorry. And we began dialysis in January of 2022. We tried at-home peritoneal dialysis first, better outcomes, and he immediately went septic and in the hospital, and I almost lost him twice. We didn't think he would make it. God's grace, he came home. It was a very dark period of my life. And if I would have had a gateway, we never would have been there.
Why is that?
Because $40 would have saved his kidneys, because he wouldn't have had untreated high blood pressure, which wrecked his kidneys.
So he went how many years untreated?
13.
13 years untreated. And it destroyed his kidneys.
It did.
Now he's on dialysis.
Yes.
Since 2022.
Yep. Early 2022.
Now, at one point you had told me, like, how much does that cost a month? When
Depending, because he went 3 times a week. So some months he would have 1 or 2 more sessions than others. So it was between $86,000 and $96,000 a month.
Wow.
For dialysis.
Wow.
Alone. That is not his doctor's appointments, for the record. That was just to clean his blood.
That's $1 million a year when you're on dialysis.
Yep. In 2022, my insurance was billed $1.2 million.
Wow.
Wow.
So if you didn't have insurance, what would happen?
He would have died.
Okay, because he wouldn't have had access to go to dialysis because he had no insurance?
That is correct. And honestly, I mean, frankly speaking, even with insurance, he almost died.
Because?
Because of the untreated high blood pressure wrecked his vascular system. They couldn't get a permanent dialysis site. And he had a temporary chest port. It was only supposed to last a year, and he was on it for 18 months. I spent 18 months waiting for the phone call. They told us, it was time to make end-of-life arrangements and consider things of that nature. I spent 18 months going to work every day because I had to work, wondering if today was the day I was going to get the call that chest port no longer functioned and he was going to have to go on hospice. And when that happened, it was going to be a matter of a few days before he was no longer be with us anymore. So 18 months, I lived like that. 18 months of there was never going to be another vacation with him. 18 months of knowing that there was going to have to be an explanation to my 6-year-old grandson, who is his best friend in the world, that Tone is no longer here. There is nothing more heartbreaking than my 6-year-old grandson looking me in the face and saying, "Mommy, can I come over? Or is Tone too sick from dialysis?" A 6-year-old should never know that. If I would have had a gateway, those would never be conversations in my house. I never want anybody to experience that, ever. You want to know what a nightmare is? That's a nightmare. I do what I do every day because I don't want anybody to ever have to go through that. That nobody should have to do that. We live in the richest country in the world. Healthcare is a right. It is not a privilege. Nobody should have to die because they need to put food on the table. That's not okay.
I know that's not the end of the story.
It is not.
We're going to get to the end of the story in just a moment. I can only imagine what listeners are thinking of what the outcome of this story is. How has that influenced your work in ministry at Gateway? Because this is simultaneously, you were at Gateway.
Yes.
While your husband was going through dialysis 3 times a week. How did that impact what you did at Gateway on a daily basis?
It made me work harder for my patients. There's a duality in that. It was very dual in nature. Number one, healing people and helping people helps me heal. It heals my heart. It gives me purpose. And, it allows me to, it helps me to help the patients. I see them. I understand them. I can tell them where I'm coming from. And if I can look up and get up, then that means I can extend a hand to my brother and sister and help them up and walk with them side by side. They're not in this fight alone because I understand them.
I can't imagine what that was like for you, knowing you had about a 3-day window, which you've told me with Tony, that if this port would fail, you'd have about 3 days until the toxins would build up and he would die. So here you are daily living with a 3-day window of you're about to maybe lose your husband and bury your husband while people are coming into the clinic with no insurance or having Medicaid, or they have insurance or underinsured, and you're trying to help prevent in their life what you experienced. and are experiencing. Talk a little bit about, Tony was on a certain medicine.
Yes.
And that added a whole nother complication. Can you talk about that?
Yes. So my husband was on a blood thinner. One of the complications that he ran into was he was all of a sudden throwing blood clots in that temporary chest port. And he had never had clotting disorder before. Warfarin, when you are trying to get a transplant, is the drug of choice. Warfarin was not good enough to treat his clotting disorder, so we had to go on a newer one called Eliquis. Transplant was not really an option for him because he was not on warfarin. The effects of warfarin can be reversed. Eliquis cannot. Transplant clinics were, like, no, we don't want to transplant you. We don't want to list you because we don't know what to do with Eliquis. It's too new. And FYI, fun little fact, Eliquis costs about $800 a month, even with insurance, because it is not generic, so the insurance doesn't want to cover that.
Wow.
So little phone call to the manufacturer, big shout out to the manufacturer on that one, with an explanation of, I can't afford your medicines, but it's needed. And they give you a discount card, $10 a month. Those are resources that I can also pass along to my patients.
That's a huge thing. I bet a lot of listeners right now are really grabbing onto that, because you had told us before about how many are on a transplant list. So Tony needed a kidney.
Yes.
How many are on the transplant list?
In the United States, there's about 101,000 people waiting for an organ, or waiting for a kidney, rather. 17,000 will actually get one, which means 84% will die waiting for a kidney in this country.
So 84,000 people are waiting for a kidney. They're probably not going to get one. And here you are looking at a circumstance where even if Tony is on the list, which he was put on the list.
Yes, he was put on the list.
But because he was on Eliquis, he wasn't even eligible for a transplant.
That is correct.
So it sounds almost like there's nothing that can come out of this.
With God, all things are possible, though, right?
And never lose hope.
That is
because
correct.
It wasn't very long ago, about a month ago, you got a phone call on Friday. Can you tell us about that?
I did. So we had actually had several phone calls. So I'm going to dial it back a little bit prior to the phone calls. I'm a very strong-willed, stubborn person. And I know.
You want to comment on that? I'm going to be quiet.
So when Henry Ford said we don't want to transplant him, I threw a bit of a fit to my husband's kidney doctor in Saginaw, who that team is wonderful. In turn, they agreed with me, and they threw a fit to Henry Ford, and Henry Ford agreed to list my husband. And they said, okay, we'll figure something out. So they listed him, and we got 3 phone calls of, well, we might have a potential match for him, potential organ, go off the Eliquis. So we did. And then they would call us and say, never mind, they don't want to do it, go back on the Eliquis. So we did. Phone call number 4, which was on Friday, April 5th. Go off the Eliquis. So we're waiting and waiting and waiting, and Sunday, April 7th, we haven't heard anything, and I'm getting a little irritated at this point. I am not going to lie. I'm like, we haven't heard anything. You need to go back on the blood thinner. You have dialysis Tuesday. And we got a phone call. Mr. Purifoy, we'd like to make you an offer. And he accepted, and they said, this is about quarter to 3. How soon can you be in Detroit? And can you be down here by 5:45? And he went into surgery at 9:30 p.m. on Sunday, April 7th, and came out of surgery. I had a cold. I couldn't go down there. My daughter-in-law, shout out to her, took him down for me because he was a transplant patient. I couldn't be down there with a cold. 4:30 in the morning on Monday, April 8th, he came out of surgery with flying colors. And because of him, they now know it is possible to transplant a patient on Eliquis, and he has opened the door for other transplant patients. And for the listeners, the kidney took hold immediately, and he is doing amazingly. And I don't ever have to worry about burying my husband again.
That's incredible. And he's a young man.
He is 58. He'll be 59 this month.
I know it's a matter of perspective, because 58 is a young man, in my opinion.
He'll be 59 this month, May 17th. He'll be 59.
Wow. That's incredible.
That's-
Such an incredible story.
That is crazy because like the sheer volume of people that are out there waiting for a kidney and like him being on Eliquis making him immediately ineligible, like, but they call him because there's a match. Like that is the goodness of God right there. Like that's crazy.
I wonder how many people have hope today, just from what you just said.
And that he was the first one on Eliquis in the United States to have this procedure done.
Yep.
Open up the door for that many more people to have
Absolutely.
kidney.
How many people are waiting for a kidney who have been told if you're on Eliquis, you're not eligible? Who now?
Are eligible.
They're eligible. You mentioned
That's
Henry
awesome.
Ford. Maybe just what is Henry Ford? Where is it? What is it?
Henry
It sounds like a car to me.
Well, it is a car dealership or a car manufacturer, but Henry Ford is a major hospital system out of Detroit. The hospital, there's several facilities in the Detroit area and outskirts like Wyandotte, and I think there's one in Novi. The hospital system that he used specifically was in downtown Detroit. They have been absolutely amazing. It's been incredible. With that being said, it's been a blessing. And one thing I have learned from all of this is God's positioned me in life and given me unique challenges. But through those challenges, it has built character. He has given me blessings through those challenges so I can help others. And that's why I do what I do.
And you're in a great place so you get to help a lot of people.
Yes.
So talk about Gateway for a moment. Is Gateway just for the people that are in Midland?
No. We've seen people from Haiti, Ethiopia, England. We've had patients drive from 100 miles. Again, if you are on planet Earth and you have breath in your lungs, please come see me.
Okay, so that's really an encouragement. I mean, because there's probably people from anywhere that it might be worth the gas to come to a place like Gateway to get the care that they need so that then we could then refer them if they needed it to the hospital. That's pretty amazing ministry, Jen.
Yes.
It's incredible that you get to be part of it. I find it interesting, and this is more of a statement, but maybe you can respond to it. In the midst of being at Gateway and serving all these people, we've served how many patients over the last 2 years?
We have seen 1,519 new patients and just over 2,600 total visits.
So here you are in the midst of this ministry of caring for patients while your husband is 3 days away from dying for the whole time that you've been with us until he got his kidney transplant. What was that? What's it like for you? I know that's really broad, but you're dealing with a personal crisis while you're at Gateway caring for people. Just maybe talk about what was that like for you?
Sometimes it's been, I'm not going to lie and say sometimes it's not overwhelming because sometimes it is. Sometimes there's a lot of tears shed. And my family at Gateway is incredibly benevolent and they're incredibly patient because they hear a lot of it sometimes and it's a blessing at the same time. And I'm so overwhelmed with the gratitude that I feel in being able to have my husband with me, but being able to serve the patients so they don't ever have to feel what I feel.
That's amazing. Talk a little bit about why do you think more churches aren't doing this today?
I don't think that they're aware that they can.
Yeah.
Okay. Now, churches used to do it. Is that correct?
That is about 100 or so years ago, 120 years ago. Most hospitals were affiliated with churches. And actually, if you want to go back to Victorian Europe, once upon a time, like during Dark Ages, during Victorian ages, it was a law that you couldn't practice medicine without Christianity.
Okay, we've come a long way. We seem to have separated out
Yes.
the spiritual from the physical or the science. Gateway's different. How is Gateway different?
Gateway is different because we do incorporate the two. It is a ministry and it is about health care, and we always plant that seed, and we do offer to pray with the patients. And if the patient says no, then fine. We're probably going to pray for you, though. I'm just saying. If you say yes, then we absolutely do. We also open every single day as a staff with prayer and devotion, which is, I've never worked for God before. I've always believed in God, but I've always worked in corporate America. And in corporate America, God isn't part of your day, that's not, that'd get you reported to HR quicker than anything else, probably. But working for God, I don't ever want to work for anybody else.
So when you ask people if they would like prayer, about how many people say yes?
I'm going to say probably 75%.
Okay. So it's really kind of funny. 100% of patients are prayed for, but only 75% you get to pray with them.
That's correct.
Others you get to pray for them. You just don't pray with them. It's kind of a funny thing if you think about it. So like, okay, if you don't want to pray with me, that's okay, but I'm still going to pray for you.
That's
you just
right.
don't tell them that.
That is correct.
So, and why is prayer so important in the healing process?
Well, first of all, with God, all things are possible. Second of all, I mean, was there any other ministry that was closer to Jesus? He was the healer. He was the physician. He said to bring your sick and downhearted. You know, he was the great doctor. This is the ministry that was probably the closest to his heart. So we have to invite him in, and we cannot do anything. I don't care if it's healing or driving home. You know, nothing we do is without him. It's got to be through him.
I have a question.
Go ahead.
Jen, in your 9 months of being a part of Gateway so far, do you have like a favorite story of a patient, without disclosing anything that would violate HIPAA, but just something that you're like, if Gateway closed, like this person would be so heavy on my heart, or the person that is like gets you up every day to keep interacting with more and more people like that?
Yeah, actually, we have a patient, and honestly, I've had my own mental health struggles over the years. I'm an open book, and I will tell anything. And there is a patient who came to us to utilize us as primary care, and this particular patient has I won't say he or she, has their own mental health struggles. And because of the services we have provided them, we did not know that they had significant struggles that created certain ideations, we will say. And because of the care offered to them and the resources offered, those ideations were stopped, and that person said we saved their life. And I understand that because I have been that person as well.
Wow.
That's incredible. As you talk about mental health, what do you see in the future for Gateway?
So many things. Where do you want me to start? I would like to start with counseling and nutrition services would be a good base point. But one day, I want to have at least 100 to 150 employees, and I want to expand services in our area so vastly. I mean, Jesus said, bring the masses, right? I want the masses.
So, Jen, what would you say to somebody across the country, maybe in their community, they might have a free clinic. Ours is different.
Yes.
Could somebody from anywhere else in the country be a part of what we're doing?
Absolutely.
I mean, what would you encourage them to do to help somebody with their health care?
I would say take a look at us, take a look at our model. You can give us a call, ask us what we're doing, ask questions. We will guide you. This can be done in every community in the United States. I won't say it's easy because it does present challenges, but it is definitely doable. It gives the population their dignity while giving them affordable health care, which again, it is a right. It is not a privilege. There is no reason that it can't be done. And, you know, they say it takes a village to raise a child, right? It also takes a village to look after your fellow brother and sister and to see to each other's health in its entirety.
So with our model of the patient pays 40, and we're asking donors if they would be so kind, and they could be from anywhere, to give a $35 gift. Hopefully, if they would consider a month, that's really easy for them to go to the website and maybe sign up to say, I really want to help a person. So if they give a $35 gift, and we take the $40 gift plus the $35 gift, they get to see the provider, and that pays for the clinic. Is that correct?
That'll pay for the office visit. I mean, it doesn't pay for everything in its entirety. It's close.
Okay.
But, you know, there are still other things sometimes, like you had mentioned, sometimes the visits take a little bit longer. And the $75, it might be a little bit more than that. And then there are other tests that are needed. So, you know, sometimes it is a little bit more expensive, but that is the median, as they would say.
Okay. And how many people do we have giving $35 a month right now.
Honestly, I don't have the exact number. I know the ideal mark would be about 300.
About 300.
Yep.
I remember Jim saying something about 125.
I think so. That sounds right.
And actually had some more people because we had a special appeal go out.
Yes.
And more people had stepped up. So I think I just want to encourage anybody who's listening to this, and if you don't have a place that really is helping the people in your community, maybe consider helping the people in our community, but with the goal that, boy, we would love to duplicate Gateway in every community. And it really takes a church. I'm a pastor. It takes a church to say, we need to do something about this. If we use our model for a minute, because I want to go back. This is Beyond the Breakwater. So Gateway is like way beyond the breakwater. And what I envision is all of these people that are in the water needing health care. And Gateway is that place that they can get to. And I would imagine across our country there are thousands, if not millions, of people that need it, need health care, and have nowhere to go. And I think I would encourage every pastor, every church leader to think about what can they do to maybe go out with a healthcare boat and just park it where people could get the healthcare that they really need and that they deserve, because it shouldn't ever be because they can't afford it, to get the healthcare that they really need. Because God wants us to be healthy. That's how He created us. Unfortunately, we have this condition called sin, that messes that up. He takes care of the sin, but sometimes our bodies don't often respond. So how about anything further or any questions you have for Jen?
I think it'd be great to just give listeners some information, because it's like you're hearing about Gateway Healthcare, but you got to see it. So if you want to see pictures, if you want to just explore and learn more, we're on Facebook, Instagram, LinkedIn. We have a website that's gwhealthcare.net. So you can, if you want to donate and you would like to give a gift of $35 so that one patient can be seen, that would be a huge blessing to this community, to that patient. And that can all be done whether it's you're right here in Midland or you're in a different state, in a different country. So yeah, we would love to have a partnership there, and just to know that it's going to something that is directly impacting people's lives. And if you're thinking about starting a clinic or starting something, or you just want to learn more, you want to chat, you can contact us at hello@beyondthebreakwater.org. Jen mentioned, call us. Gateway's number is 989-259-1000. So yeah, I think that's all I had. Was there anything else?
No, Jen, anything else to share with people who are listening today?
Just if, we can get this into other communities. My story is not unique. There are millions of Jens and Tonys out there, and it might not be a kidney. It's those that, have untreated diabetes and other health conditions that they can't afford to treat. You guys can help them.
I have a feeling our phone's going to blow up here real quick.
That's okay.
Thank you, Jen. Thank you for sharing your story, for being vulnerable with us, for just sharing your experience, because I think that resonates with a lot of people, whether they speak it or not. So thank you for what you do and who you are.
Thank you.
Yeah, we'll see everyone next week. Thanks for tuning in to this week's episode of Beyond the Breakwater, a podcast of Elevate Community Ministries. Don't let the conversation stop here. You can email us at hello@beyondthebreakwater.org. We would love to chat with you, answer questions, plan a visit, and help you take your next step. We'll see you next week.